A med spa is sometimes used interchangeably with like medical spa, medi spa. And what it is, it's pretty much a hybrid of like estheticians type services like skincare, anything that has to do with like beautifying yourself, right? But it adds a medical component. Some of the things that people do or get done to themselves requires a medical professional to administer them. So you have the side that's non-medical, which is like aesthetic services, things like that. And then you have the medical side, which is like technically pharmaceutical companies create products that help our skin, that makes us, look a little bit younger or age gracefully. I'm just being PC, politically correct, but pretty much that's the medical side. And so a med spa pretty much combines all of those different facets, brings them together. And it's done in like a beauty type spa setting, right? So it's not like pasty and cold like a doctor's office. It's really, really nice and, just really spa-like, but you're getting medical treatments as well. A lot of people don't like really understand it. Most people who either have been patrons of it or those who are in healthcare who are actually interested in operating a med spa or aesthetic business knows about it. So, but most of us we know about Botox. So if you know about Botox, that is one of the treatments that is offered in a med spa, medi spa, or an aesthetic practice.
Very interesting. So it's combining the two. Do you have to be a doctor to open a med spa?
It depends. You can be a nurse practitioner in some states. In other states, you may have to have a medical doctor to be your director. It is the medicine. So like it's state specific. Some states are very, very strict. And say like, a doctor has to own it, period. And then other states are like nurse practitioners can, nurses can, like I'm in the state of California. So if you're a registered nurse or any type of healthcare professional, like a social worker, physician assistant, occupational therapist, physical therapist, they can own minority in this type of practice. Other states may say, no, you have to be a medical doctor and they have to exclusively own 100%. So there's a lot of variability and it's really uniquely positioned depending on the state. So it just all depends is the answer to that. It really depends on the state. It's very state specific.
I guess because I'm in a licensed industry, so I give people the Google phrase in like, here's how you look up your state. If you had to give someone a Google phrase to look up like your state plus, what would that be?
It would be going to the medical board, because it is the practice of medicine, and then the board of nursing, if they're a nurse, I would tell them that. And if they wanted to just like generally go on Google, it would be specific to their industry. So like, can a physical therapist own a med spa in California? Or whatever their state is, because it's but if they wanted to like really dive a little bit deeper, you would go to the medical board in your state. And some medical boards are not as strict as others, if it makes sense. So they will allow other healthcare professionals to have ownership. Then you have some states like the state of Florida that anyone can own a med spa, even if they're not a healthcare professional, but they of course cannot practice, but they can have ownership. Where in the state of California, you cannot own a medical practice unless you're a medical provider or healthcare
Okay, you couldn't even partner with the medical provider.
You could not partner with them directly, but we're in a capitalist country, honey. So there's always a way, for sure.
There should be, because you're partnering certain things.
Yeah, because, of course, when you think about medicine, you have to think about there's certain restrictions we have, like there's anti-kickback. So they want to prevent people from, it's a real fine line when it comes to medicine, because it's like people are making money off of medicine, but we want people not to be guided by the money that you can make. Instead, they're supposed to be doing what a medical provider has deemed necessary, right? And so it gets really gray, but in a nutshell, there's ways that you can work with professionals and still they can be in their lane, right? As a non-medical professional, you cannot tell a medical doctor how to treat a patient. Do you understand? So, but it doesn't mean that other things that goes on in the business that's non-medical, you can handle, right? As a non-medical person.